Dear all, Namaste. In this video, I will be discussing about case presentation on ear case, that is chronic suppurative otitis media tuberculous type or chronic otitis media mucosal type. First, we should know the patient's particulars. This is an imaginary name, Sarita Shrestha, 23 years old female from Pokhara, and she is housemaker by occupation. So when the patient is having certain occupations, you have to specify. Suppose a patient with CSOM TT may be swimmer by occupation, swimmer or water worker. They are more prone to have ear disease. Then date of presentation or examination may be same date or maybe different date. Date of presentation may be one day and examination may be other day. And write the chief complaints. Please write the chief complaints in chronological order. Here, the patient presents with right ear discharge for 2 years and decreased hearing from right ear for 1 year. Coming to history of present illness. Don't write HOPI. The patient was apparently well 2 years ago when the patient started having right ear discharge, which was insidious onset, copious in amount, mucoid in consistency, yellowish in color, not blood stained, and it was not foul smelling. This is very important. You have to explain everything regarding the discharge. And when the patient remembers the discharging time, then it may be written as sudden onset, because many patients know I had ear discharge suddenly. Sometimes when the discharge was since childhood, the patient cannot remember the first discharge. And how did it occur? So insidious onset is a good thing, but if the patient remembers, you have to write according to patient's preferences. By the description of this discharge, you should be able to differentiate CSOM TT from CSOM AA. So this history goes towards CSOM tuberculous type. The discharge was intermittent in type, used to occur once or twice every year, each episode lasting for 4 to 5 days, and used to stop with use of ear drops and oral medicines. This can be written after insidious onset also. The discharge used to aggravate on winter seasons and when the patient had bouts of common cold. This is important. The discharge in CSOM TT is not continuous, this is intermittent, and this is usually aggravated with the common cold or winter season. And the last discharge was 1 month ago. This is very important, because you will stage the CSOM TT according to last year discharge, maybe active, maybe quiescent, maybe inactive, or maybe healed. Just go through my YouTube CSOM TT. Now the second chief complaint was decreased hearing from the right ear, which was insidious onset, progressive in nature, worsening with time, and difficulty to hear soft sounds from the right side. This has to be written because the patient has difficulty to hear the soft sounds, so patient is having probably conductive hearing loss. The hearing gets better during the time of ear discharge. Most of the students write like this, but this is not necessary and not mandatory also. Okay, but if you know the reason, then you should write. If you don't know the reason, don't write it. Examiner may ask why the hearing is getting better during the time of discharge. You should be able to answer this is due to the discharge creating a fluid level in the middle ear that creates a phase difference between the round and the oval window. So this has to be answered. The decreased hearing has partially affected his daily communication, but he has not used any aids to improve his hearing. So patient does not require hearing aid, although it's partially affected his hearing. Then come to negative history. It is also important. There is no history of earache, swelling around the ear, fever, deep-seated headache, blurring of vision or double vision, severe headache, facial asymmetry, tinnitus, vertigo, gait disturbance, projectile vomiting, neck pain and stiffness, irritability, loss of consciousness, convulsions. You can see here the chronology of negative history, that is the first external ear, then inner ear, then brain. The negative history is trying to elicit if there is anything in the brain, or if the patient has undergone any complications. As per the negative history, there are no complications. There are no similar complaints in the opposite ear and no complaints related to the nose and throat. This is very important. Don't forget to ask about the opposite ear and the nose and throat because we are taking history on ear, nose and throat. Coming to past history, the patient did not have any history of similar episodes in the past. Coming to past history, the patient did not have any similar episodes in the past. The patient has no history of diabetes mellitus, hypertension, tuberculosis, and previous history of operations in the past. If there is surgery of similar kind, then you have to explain why diabetes mellitus, may lead to malignant otitis externa, or there may be delay in the wound healing process. Hypertension per se doesn't have relation to the ear, but patient may have hearing loss. And tuberculosis. Patient may have tubercular otitis media, which is different type of otitis media and may lead to multiple perforations of the tympanic membrane, pain, and chicken fat granulations in the middle ear. So you need to be careful sometimes. Then coming to drug history, the patient used to use ear drops and oral medicines for the ear problem. That means same problem, but it's helping sometimes. The personal history is very important. The people have habit of cleaning the ear with Q-tips, swimming in the ponds, or putting oil in the ear in the present also. So the history has to be well explained. Forceful nose blowing also may lead to perforation of tympanic membrane or the infection going through the nasopharynx to the ear. So you should explain that. And patients smoking and alcohol habits and bladder and bowel habits. The patient may smoke himself or herself, or there may be passive smoking. That also leads to infection. Family history. How is the patient's living standard? The patient's type of house, family members may be overcrowding, and member with similar problem. Sometimes chronic otitis media may be found in other members of the family. Poor family living in small house, kacha house, may also lead to overcrowding, maybe CSOM TT in unhealthy environment. Then coming to examination, general examination like pulse, BP, temperature, respiratory rate, pallor, icterus, clubbing, cyanosis, lymph node and edema, they have to be looked for. In local examination of ear, first we will see the pinna for its size, shape, position, color, pre and post auricular area, pre-auricular sinus, swelling, scar and fistula, post auricular groove and sinus, swelling, scar, fistula, like that. Then you have to palpate also. Inspection and palpation both are to be performed. Refer to my clinical examination of the ear on YouTube or SlideShare for more details. Please refer to that. Examination of nose and PNS also has to be performed. Examination of oral cavity, pharynx and larynx also has to be performed. Examination of neck and systemic examination of abdomen, cardiovascular and the CNS systems. Most of the times we will ask for brief case summary. That means pertinent chief complaints, positive history and positive findings and examination are to be explained. Then comes the provisional diagnosis. In provisional diagnosis, you have to write right-sided chronic otitis media mucosal type, which stage with how much hearing loss, may be mild, moderate, severe hearing loss according to the twin fog test, conductive or sensorineural. The mostly in CSOM TT will have conductive hearing loss and no complications because CSOM TT is supposed to have no complications. Then come the investigations. First, you should write PTA and examination under microscope. They are very important. When the patient is having active ear discharge, then sometimes pus from the ear can be sent for gram stain, culture and sensitivity. But when there is no discharge at present, don't write that. X-ray mastoid can be performed for mastoid pneumatization and routine blood test for patient's sugar status. And if you are planning for surgery, then routine baseline investigations for GA or fitness under anesthesia. Otherwise, the most important investigations are PTA and examination under microscope. They are very, very, very important. Then comes the treatment, either myringoplasty or demonoplasty. How to select the posture by PTA findings and steps of surgery, advantages, disadvantages, complications of the posture can be asked in the exam. This is all about case discussion on CSOM TT. Please refer to my examination of year for more details. In this video, I am discussing on case presentation only. You should know how to write a brief case summary and how to present the case in details. Thank you. Have a good day.